Right. Hi, everyone. Thank you so much for having us. My name is Vrithi, and I'm one of the presidents of Health Hope Initiative.
And I'm Tanvi, the other president of Health Hope Initiative. Okay, so before we get started with our presentation, we wanted to introduce ourselves and tell you guys about who we are and what we do. So we're a student-led organization, and our mission is to create a healthier future for women by spreading disease awareness, promoting early detection, and providing critical support and resources. And to do this, we have multiple projects that we have started to try to alleviate stress for women that are undergoing cancer or other health conditions or medical conditions. So one of this projects is the care kits. And the care kits are essentially just self-care essentials that are packaged, and we have delivered them to many hospitals. And these are created through the help of our volunteers. We also have care bracelets, which are handmade bracelets that are crafted by volunteers to show support. And lastly, we have cards of compassion, which are just cards with heartfelt messages that would accompany our donations. And we have donated to multiple hospitals, including RWJ Cancer Institute, Children's Specialized Hospital, St. Peter's, Hackensack, and more. So there are many ways to get involved in our nonprofit. If you're interested, we host donation drives, collaborate with other nonprofits, and we organize summer workshops for kids, inspiring them to make a difference. And in the past, we have had nonprofits reach out to collect items to distribute through our care kits. So we have volunteer teams, which consist of research, tech and media, community outreach, and health advocacy. We also have multiple fundraisers throughout the year, including bake sales, lemonade stands, and more. And we have multiple workshops, as I mentioned, for younger kids that are informational. Okay, so now we'll start to dive into our topic. So, why does early detection matter? So, first, it definitely improves survival rates. Early detection often leads to more effective treatment options and it increases chance of survival. It's also a less aggressive treatment option because if you detect health issues early, then it can result in less invasive or big treatments, which can alleviate any complications. And overall, it's just a better quality of life because there are fewer long-term effects if you just recognize these symptoms early on and it prevents any aggressive treatments, as I mentioned. And overall, just prevention is a really good thing to do to avoid more severe outcomes and just to have a good lifestyle overall. So, there are multiple standard screening techniques that are used today. One of them is mammograms. Regular mammograms help detect early signs of breast cancer, which is good and it improves further outcomes. Pap smears, which is a screen for cervical cancer, and it allows for early intervention before the disease progressive. Also, blood tests. Hopefully, everyone gets routine blood tests, which can detect any markers for various diseases, which can help lead to early diagnosis. And also ultrasounds and MRIs, which are important as well. These are imaging techniques used to detect abnormalities in organs or tissues, and they may not necessarily be visible through any other methods. So there are some barriers to timely diagnosis, which is important to recognize. For example, lack of access. There is limited access to healthcare services in certain areas, which can delay diagnosis, but there are ways to get around this. So you should definitely recognize that and try to find ways to get access to healthcare. There's also financial constraints. For example, high costs of screening or treatments may prevent individuals from seeking early diagnosis. Awareness gaps, many people aren't aware of the importance of screenings or available tests, which could lead to delayed detection. There are cultural and social barriers um, that discourage individuals from seeking timely medical help, and also insurance challenges, since insufficient coverage of insurance or complicated insurance processes could cause delays in getting necessary screenings.
So now we're going to talk about a more recent innovation in breast cancer detection, and this is the use of artificial intelligence or AI. So recently, AI has been a significant innovation in the detection of breast cancer. AI systems are able to do this by being trained using many images taken from scans, such as MRIs, mammograms, ultrasounds, and more. This helps to identify patterns in cancer, and they can scan images to point out any abnormalities or suspicious images. Aside from detection, AI systems also help determine if a tumor is benign or malignant, and give doctors more accurate information about its size and shape, which overall helps with earlier and quicker detection of breast cancer. So there are several tools used in breast cancer detection, and many of them are incredibly small but have a huge impact on the outcome. So one of the tools we're going to be highlighting today are radioactive seeds. These are small sesame seed-sized metal seeds that are used in a treatment process which is called breast cancer localization. So, as a part of this process, these seeds are placed into any tissue that is suspected to be abnormal in the breasts, which helps keep track of its location, so that during surgery or any other treatment, the surgeon uses a procedure to remove the seed and the surrounding tissue to make sure that all of the abnormal tissue is removed and to also lower the amount of healthy tissue removed, which has the best impact for the patient in the long term. So recently, there are more personalized screening approaches which are being developed for breast cancer, which basically helps there be individual screening approaches for each person depending on their risk factors. So one such screening approach is risk-based screening. So this uses the breast cancer risk assessment tool to help doctors estimate someone's risk to develop breast cancer. And this can estimate someone's risk both now and in the future, which can help give us better insight into the screening required for that specific person. Another approach is genetic testing, which can be used to gain insight into a person's risk level for developing breast cancer and other diseases by looking at their genetic makeup. So, as we mentioned, there are many disparities in accessibility to breast cancer screenings and detection services, and there are currently many efforts trying to bridge this gap. So one effort we wanted to highlight are mobile mammography units, and these help to bring mammograms to more rural or all areas with certain places. One example of this is Mount Sinai Hospital in New York, which brings its mobile mammography units to all parts of the city. There are also community health programs which offer low or free screenings for people who may not have accessibility to other forms of screening, and they offer mammograms and many other types of scans in communities. Technology is also a main way that this gap is being bridged, and as we talked about, there's an increased role of the use of AI in breast cancer detection. There's also advocacy by many organizations and groups advocating for more accessibility to breast cancer detection. So, what lies ahead? So one thing which we will bring up again is AI enhanced imaging, which is helping and will continue to help in more accurate detection of breast cancer. A new technology also being developed is liquid biopsies, and these can help analyze someone's blood samples and differentiate those with and without breast cancer, which again can help with a quicker detection of the disease. And as we previously talked about, more personalized screening approaches are also being developed for breast cancer, which promotes earlier detection and treatment of breast cancer, which really helps patients have the best outcome. So there are so many ways you can help with this cause. One way is to raise awareness, which includes sharing information, encouraging screenings, and promoting early detection. You can also donate and support various advocacy and nonprofit organizations, local groups, hospitals, and so much more. Volunteering is another great way to help out, and there are so many ways to volunteer, either at hospitals, breast cancer events, fundraising efforts, and more. We can also promote early detection by participating in regular self exams and mammograms and engaging in efforts to make them more accessible, as well as also encouraging other people to participate in regular self exams. So, thank you so much for having us.
Thank you, and please let us know if you have any questions.
Yeah, that is so great. Thank you so much, guys. Um, give a couple minutes. If you guys have any questions, feel free to leave it in the chat. If not, I'll just go ahead to move to our next presentation. Alright, so our next presenter is Mini Medic. So if you're ready, please just pull up your slides.
Hi, yeah, just give me a second and I'll share our screen. Do you guys like see the screen?
Yeah, I can see it.
Just okay. So today our organization, Mini Medics, is here to talk about children's health. So we feel as an organization that it's kind of under stressed, and we thought might as well just talk about it today. All right, so hello again. So here we have our contact information, our Instagram handle, if you ever just want to check out what we do. And basically, again, we're an organization that's focused on the health and well-being of children all across the globe. It's really nice to meet you.
Prablin. I'm also one of the founders of Minimedics, and it's great to be here. So, this is our table of contents. We're going to begin by talking about how children's health is different from that of adult health. The second one would be that we'll be talking about some of the leading causes. Then, why is it important? Why should we talk about children's health? We have preventative measures, and then also a real life story about one of the children's. And then we finally have our next steps.
All right, let's just talk about the difference between children's health versus adult health, because I just think that's really important that we put the differences, like we kind of categorize it right before we even try to fix it. So, children's health is more focused around social and emotional health and well-being. Now, that's not to say that for adults health, oh my gosh, you can just like throw your mental health down the drain, right? That's not what's happening. Children's healthcare, you're on thin ice, right? Because they feel stuff a lot more differently than adults would, right? They take things a lot more differently than adults would. There is also anatomical differences, and I would say that that goes without saying, right? Because in kids, like vascular access is a lot more difficult, right? So like hypothetically, if some kid goes to get a blood test and the nurse can't find the vein and he has to like poke again, that can kind of cause a bunch of issues. And then you hear kids saying like, "Oh my gosh, I don't want to go to like the blood test lady because their vascular access is different and it's a little bit more difficult giving them treatment, which is why kids might find it a little bit more difficult for them to go through that treatment as well. They also have thinner skin and they're more prone to vomiting and diarrhea, which I think is something we tend to forget, right? We panic, we're like, oh my gosh, my child's vomiting. Sometimes you'll realize that as you get older, you vomit less and have diarrhea less. And that's just because your immune system is more established, unlike that of children's. Now, in terms of adults' health, they're a lot easier to work with, right? They have more maturity, they understand better. They're overall a lot easier to deal with because they kind of know what's going on, right? However, I do think it's also important to consider that they can better cope and manage the stress that comes with being given a diagnosis. And moreover, they can even take stronger doses. And I feel like you can't exactly prescribe any medication to children, right? Because like aspirin, that causes like Graves' disease and stuff in them. But in terms of adult health, you can really give them anything, and it's just a lot more easier to treat them. So, what are important considerations as future healthcare providers, as individuals who may have younger siblings or something like that? I think it's important, like I mentioned earlier, to be very considerate of emotions and discussing diagnosis in a way that's not exactly intimidating, right? Don't like tell the kid something like really, really gory or something really, really emotionally intensively difficult for them to process, right? It's also important that as a medical professional, it's important to have a welcoming atmosphere and not overwhelming the patient. So maybe don't have someone who's getting a tooth extractions room like right in front of the waiting area, because that could really be a big red light for children. It's also important to account for differences in understanding and maturity, right? They see a sharp tool, they're going to freak out. So I think no matter how many times you try to explain to them that you're not going to use it, if the sharp tool is there, it's there, right? So maybe account for that fear and account for that innocence that children have. Also, I think it's just always useful to have like fun names for tools, right? Like per se, you go to the dentist, and again, they have like a sharp tool. They may call it like I don't know what you call it, or they have like that hose thingy. They'll call it like a water hose instead of like what we actually call it, which is something that sucks saliva out, right? So maybe try to consider making it fun as opposed to stressful.
So now that we know about children's versus adult health, I'll be talking about some of the leading causes of illness or some of the important, I would say, diseases that are affecting children. Next slide. Okay, so I don't know if you guys can read the kind of the pictogram or the chart that I have, but it kind of states that some of the leading causes of diseases among children, and then some of them include tuberculosis, respiratory diseases, meningitis, even digestive system diseases. That are some of the things that are really impacting children. And then if you see here, like there are other injuries that are impacting children, but mostly it is health related disease that are affecting it. So I think it's really important that we talk about children's health and we kind of don't ignore it. It's really important. And I also have some of the statistics on the right hand side, which is that child mortality is one of the biggest problems that is present in the world right now. Even though I know whenever I say about world, you might think it's poverty or there are like a lot of other diseases that are affecting the world, but I would say child mortality, we have to take it seriously. And then there are around like 6 million children under age of 15 that die every year, and then that's around like 1,600,000 like each day. Now it's even though it's globally, but I think 1,600,000, it's like a lot. And then the saddest truth is that a lot of deaths tend to be preventable. So for example, if you see tuberculosis or measles and mumps and rubella, they tend to have vaccines to them. So most of the diseases that we have, they're mostly preventable, but there are some of the preventative measures that we have to take in order to be get better at it. And then while we have improved a lot since the past, I would say we still have a lot of way to go. And and it's the statistics are around like 2022 to 2023. They're not like a lot recent, but I would say it's recent enough that it's important to consider all the stuff that we have here. Next slide. Okay, so now I will talk about some of the factors that might play a role and that might be really impacting children's health. So first one itself is access to healthcare. So if you see, there are a lot of places where there might not be access to healthcare facilities, and a lot of people are not even aware of it. For example, vaccines. A lot of people are not like they don't have access to vaccines everywhere. So for example, if we take the example in India, there are some states, or you could say there are some places where a healthcare is not like easily available. There aren't a lot of doctors to provide them, so access is really important. Then the next one is affordability. Considering the inflammation nowadays, I would say it's like getting really expensive. For example, if you take the example of cancer, if you get cancer, unfortunately, the medication for cancer is getting like really expensive. And then I was researching and I found out that if you want to take like 4 cycles of cancer vaccine, like if you want to take chemotherapy, it could be around 48,000 per year, which is like really, really costly. And it could be like really impacting you if you come from a lower socioeconomic background and you might not be able to afford it. And then the third one is, which a lot of people might be ignoring, is environment and surroundings. So your environment and your surroundings really play like an important role. For example, if you work, or even if you as a child you are playing near playgrounds, or there's some sort of pollution, or the environment is not good enough, it could be really hazardous. And then even the chemicals in the water, or even the food you eat, is like really impacting you. The next one is malnutrition. If you cannot afford food, or if you're not getting like good enough food for yourself, it could really impact your health. So because at the end of the day, it's the food that give provides you the energy, and if it's not good quality food that you're taking, it can really impact your health. And then lastly, could be poor hygiene and living conditions. So for example, if you're living in an unsanitary place where you do not have access to clean water, to drink clean water, or places, or even your house, if it's not like good enough and then it's not sanitary enough, I would say it's like a really big cause of children's health too. A lot of diseases, communicable diseases, even non-communicable diseases, it could be a biggest factor for you, and then it can really impact your health at the end of the day.
All right, so now let's just talk a little bit about why this entire concept is just so important. All right, so first of all, I would say that healthcare as a child is the foundation for good long-term health. So any habits that you have when you're a child, they tend to carry on into adulthood, right? Like any influences, anything like your mom used to make you when you had a cold, that tends to carry on into your adulthood and into what you do to take care of yourself. So if you have a good habit, you have a long and healthy life and you feel more sure about yourself. Number two, creating a strong self-esteem, which I feel like that whole idea is just undervalued, how important self-esteem is. And you have to be able to instill confidence in them, right? If they feel good, they feel happy, they don't feel like something hurts or something like that, it's going to have a more positive impact on them, right? So, in order to give them that sense of confidence, I believe that quality and focused healthcare is definitely something we should consider. Number three, healthcare, especially as a child, it really does help avoid long-term and chronic disorders in the future, right? So oftentimes, I know a common theme in a lot of the other presentations we heard today was misdiagnoses or not being diagnosed at the proper time. And I find that many parents tend to skip on pediatrics as a whole, right? So if a child has a genetic abnormality or if they have some kind of a disease and it's not looked at, then I feel like the impact of not having treated that disease would definitely hurt them in the future. So definitely look at something now, try to prevent it now before it really spirals out of control. So I just wanted to put this little chart here, and basically it just tells us that based on this kind of situation that their child may be in, right? If they have one condition, multiple conditions, if they have neurological impairment. So based on that, this is how many people or their parents, their caregivers, this is how what percent of them are stressed, right? And you tend to see that most of them are stressed, but I feel like all that stress tends to happen because they didn't get them checked fast enough. They didn't go to their pediatrician and say, "Oh, my child says this hurts," or "My child has been vomiting," right? Like a lot of this distress comes from the fact that they didn't go and get the kids a visit to their family doctor. That's basically it. Okay, so what can we really derive from that, right? So the type of healthcare children and their families receive earlier on greatly impacts the prognosis of any given disease or disorder and how fast they're able to recover, right? So if you get a a diagnosis earlier on, you're able to cure that diagnosis earlier on, chances are the rest of your life's going to be a lot better instead of ignoring a diagnosis and then having like a really, really bad version of it later on. So focused and appropriate childcare that's early and timely is definitely the way to go.
So now I'll be talking about some of the preventative measures and about a real life inspiring story that I found online. So, this story is about Lucy, who was a 2-year-old child who was diagnosed with a very rare disease that only 280 people among the global have known to report. So, Lucy and her mother were doing great. And after the third day of her stay at the hospital, there was like a really unexpected seizures that she got. So, Lucy had to stay in the hospital for a week and had to go through tons of tests including a CT scan, an MRI, and also an ECG. However, none of them were able to identify a cause for a seizure. So she was given a medication that stopped the seizures and she was discharged. But after 2 months, it returned again. After a few days, she completed a genetic test that is called epilepsy panel, and Lucy was diagnosed with a rare neurological condition called STXBP encephalopathy. She was then referred to a pediatric neurologist, where all the health professionals and her parents worked hard to move the research to find a cure for this rare disease. While the family was fighting to move research forward, Lucy continued to have seizures because standard medications were unable to stop it. And then Dr. Bergquist, who's also the director of CHOP's dietary treatment program, which is one of the largest prescribed diet. Like the doctor described her to have a keto diet, which kind of stopped the seizures for Lucy, and her family was actually really happy because even though there isn't a cure yet for this medication, her seizures had actually stopped, and she was able to live a normal life. And through her hard work and then the dedication from her parents, the doctors, and all the healthcare professionals, Lucy is now a sweet and snuggly little girl on the verge of her second birthday. So she receives often like she receives occupational therapy, and she also receives physical therapy and special instructions every week so that she could work on like kind of helping her with this cure. Even though there isn't a cure to this rare disease yet, she's working on and she's kind of getting better with it. Next slide. So, two of the important quotes from her parents that really stuck out to me were, as painful as it was to find about Lucy's diagnosis, it was really helpful to know about it early on so that we could get her into early intervention and therapy as quickly as possible and try to combat some of the global delays associated with these diseases. And then the second one would be, if it wasn't for genetic testing, we may have gone years without a diagnosis for Lucy. So as we also discussed earlier, that early diagnosis is really important, as if Lucy hadn't got the seizure early on, like at the third day of her birth, it would have been really hard, and the condition that she had would have gotten worse over the time. So it was really good for Lucy to find out early than not to have find out. And then some of the preventative measures that are really important and can prevent it include exercising and maintaining good hygiene. You might think that even going for a walk for like 10 minutes is not going to help you, but even doing that is better than nothing. And really kind of exercising and maintaining good hygiene can help you, and then it can also having good and then strong immune system can help you fight diseases and then protect your health itself. And then is eating healthy food. Now I won't say that you should completely avoid junk food and then you shouldn't eat any fast food at all. I would say that you should have like kind of a schedule for yourself. For example, if you have eaten like a lot of fast food for one day, maybe try to avoid it the next day, and then maybe try to eat some healthy food, and then try to kind of swap out foods. For example, if you're really craving for sugar, maybe try to eat fruits or any other stuff that has more natural sugar to it. And then even though I know that we also have like a taboo about taking vaccines, but I think having like vaccines can really help you. For example, there are like polio and measles. These are like really life-threatening disease, but vaccines have really protected children from it. And then getting proper amount of sleep is also important to make sure that your brain and then also your body is functioning good. And then visiting family doctor, I wouldn't say that you need to like every week you need to go there, but like for example, you can have frequent checkups, like annual checkup, or maybe even monthly is a good option. And then investing time right now in your health as children's can really help you in the future and then help you overall as a human being.
All right. Now, this is just the final part of our presentation. We're just going to talk about next steps and different things that we could do to really help lessen the effect of poor early on childhood healthcare and how we could currently fix our medical system when it comes to childhood healthcare. All right. So, what are the issues when it comes to providing children with healthcare? So, first of all, I would say access is a huge, huge issue. In most parts of the world, many children, they're denied proper healthcare because of economic conditions, right? Lack of resources. If you're in a developing country, then maybe your scientific team or your medical research is not that strong. So, ultimately, accessibility causes one of the largest issues and poses the largest threat to children's health and well-being. Second of all, frequency. Now, I don't think we can stress this enough. Scheduling more than one pediatrician visit is not bad. Like, honestly, at least have one a year because the wonders it works is incredible. You can detect so many things in advance and make such a big impact. Next, opportunities. Now, I feel like we don't tend to use up this market that much, right? There's so many interesting ideas, creative industries that can all just be created for childcare, right? Like child-friendly dental instruments, child-friendly stethoscopes, right? Like this is great on both an economic level and on a level that it makes it easier for us to treat children and make them feel more welcome into in a healthcare setting. Finally, threats, right? Um, I would say that one of the largest threat to children's health is the fact that many parents tend to think that, oh, nothing's going to happen to my child. My child's okay, right? We don't need to take them to the pediatrician. We don't need to invest in their healthcare specifically because, oh, they're just a kid, right? They're young. They could like literally do anything they want to. However, that's not always true, right? And a parent's mindset is something that is carried on by a child. Now, emotional sensitivity is something that we tend to forget as we get older. Like, we tend to forget that children don't exactly have the same understanding, same maturity, same capabilities of processing information as we do. So sometimes it's good to get professional advice, and sometimes it's good to be a little bit more open-minded as a parent.
So now just to wrap up our presentation, here are the key takeaways that we discussed throughout the presentation. So firstly, we discussed about children's versus adults health, where we discussed about how children are more vulnerable compared to adults and they need very warm and welcoming environment. Additionally, when we deal with kids, we need to be friendly and then maybe even speak in a way that they understand us and then they're not scared. And then we discussed the leading causes, which is that there are like 6 million deaths per year. And then also that we need to have, there are like some factors that we should be avoiding. So, for example, people from lower socioeconomic backgrounds are not able to afford. So maybe we should have more initiative towards helping them out. And then we discussed that why is this topic, and then why is children's health important. So we discussed about how it impacts their overall well-being, and how developing good like long-term habits can help you in the future as well. And then finally we had our preventative measures, where we discussed about how Lucy's story, and then how she overcame and the rare disease that she had because of early diagnosis, and the help from the parents and the healthcare professionals that she was able to receive. And then we also had some preventative measures such as exercising, which can play a huge role in keeping a child healthy.
So these are just our sources, and yeah, that's it. Thank you so much for listening. Thank you so much, PinkGap, for inviting us here to talk about children's healthcare. Our handle's down there if you want to check out our Instagram page and see what we're all about. Thank you so much.
Once again, thank you. It's great to be here.
Thank you so much. That's a such great amazing presentation. I like how you guys talk about like real life stories. That's just amazing. All right. Anyone has any questions? Okay. If not, we'll just move on to next presenter. Our next presenter is Donate Essentials. So, if you're ready, please pull up your slides.
Yeah, of course. Can you guys all see this?
Yeah.
Okay, perfect. So if you, do you want to start the presentation off?
Yeah, okay. So, hi everyone, we're Donate Essentials. Our ongoing objective is to spread health literacy among our community. And this is accomplished mainly through our health literacy blogs, where volunteers write articles about different health topics, which are posted on our website for people to see. And also, we have several projects of donating essential health items into people in need. So, but this presentation is mostly about spreading health literacy and the importance of doing that.
Okay.
So first we'll overview what is health literacy, why is it important, and also we're going to highlight individual benefits. So for example, how does health literacy impact our lives? Also how health literacy benefits the community. And lastly, we'll talk about next steps that you can take to improve health literacy and help the community.
Okay, great. Thank you. Hi, my name is Amy, and I'm here today as a representative of Donate Essentials. And basically, I'll be starting off with the first two things. And so let's get into it. So, what is health literacy? Health literacy broadly defines the ability to find, understand, and use information in ways to promote and maintain good health. Having health literacy skills simply means being able to do tasks such as reading pamphlets, making appointments, understanding food labels, and complying with actions from the doctor. Now, let's take a look at this figure that shows adults' health literacy levels during 2003. Shockingly, only 12% of the adults have proficient health literacy, exposing a significant gap in the public health awareness. This means that about a third of U.S. adults, approximately 77 million people, struggle with common health tasks such as understanding instructions on a prescription drug label. Looking at the chart more closely, let's break down the four types and see what each of them can do. Basically, below basic skills consists of only being able to read about a set of short instructions and then identify what is permissible to drink before a medical test. A step above that would be able to read a pamphlet and give 2 reasons why a person with no symptoms should be tested for a disease. Intermediate is being able to read instructions on a prescription label and determine what time the person can take medication. For example, if I was taking Tylenol and it was advising me to take 1 in the morning and 1 at night, and me choosing to take them at 8 a.m. and 8 p.m. respectively would be a sign of intermediate health literacy. Lastly, proficient health literacy is being able to use a table to calculate an employee's share of health insurance over 1 year. So now that we've covered the basics, let's get into how it impacts individuals. Me, you know, us. First and foremost, health literacy impacts our decisions. Having health literacy skills allows us to make objective, thoughtful, and intelligent decisions about health services, medical facilities, and other aspects related to a condition. Moreover, we can also interpret statistics about the risks and benefits of a treatment, which creates more knowledgeable decision making. It's not just about treatment services, however. This access to information prevents patients from wrongly interpreting medication instructions and warning labels. Increasing independence on the health system is important as taking control of your health is essential to a life full of wealth. It, paired with the two other factors, allows for increased beneficial patient autonomy. Patient autonomy is essentially just the right of patients to make a decision about their own medical health care without the healthcare provider trying to influence the decision. Patient autonomy does allow for healthcare providers to educate the patient, but does not allow for the healthcare provider to make decisions for the patient. When patients lack health literacy, it can set them back in their ability to manage their own needs effectively. They may struggle to self-manage diseases and take preventative measures, leading to overusing healthcare resources and ultimately higher mortality rates. This can create a cycle of poor health that is difficult to break, leading to a higher reliance on the healthcare system. Healthcare is not just a personal skill, it's a public health priority. Addressing this issue can break the cycle of poor health outcomes, reduce reliance on the healthcare system, and empower individuals to lead healthier, more independent lives. By improving health literacy, we can take a vital step towards a healthier future for everyone. Yuya will be talking more about this now.
Yeah, so what are some community benefits that come with health literacy? Next slide. Okay, so firstly, it lowers healthcare costs and optimizes resource use. If people are knowledgeable about how to take care of their health, there will be less need for medical professionals and there would be reduced costs necessary for people to take care of their health and go do checkups with the hospitals themselves. Amy, could you go into present mode? Okay, secondly, it improves quality of life by improving crisis response and community well-being. What this means is if people are more knowledgeable about what to do in health crisis situations, there will be a overall increase in the wellness of the community. Equity, having better health literacy improves access to health care and it'll help people be more knowledgeable about how to take care of their own health when they do not have access to very good healthcare facilities. For example, for the people who do not have immediate access to hospitals, if they know how to take care of their own health or help prevent crises from happening, it improves overall community well-being and helps equity throughout our community. And lastly, it generally prevents disease and improves health outcomes by promoting health literacy. Okay, so here are some next steps on how you can improve our community through health literacy. Yeah, so first step, you can feel free to benefit from health literacy. Take care of your own health because by staying healthy, you prevent you yourself from spreading the disease or other infectious bacteria to other people. Know what's good for you and take actions to improve your health. This includes both physical and mental health. For example, exercising regularly and eating healthy improves your physical health, which directly benefits mental health. And if you are healthy, both physically and mentally, you will be better suited to help other people in your community. Also, continue to learn more about health literacy. This is a great way for Donate Essentials to come in because we offer free and accessible health literacy advice to anyone in the community through our website, which will be on the next slide. Yeah, so here's the QR code to access our website. There's also the website URL. So we would love for you to support our mission or just to benefit from it. spread health literacy to others through sharing our blogs, and you can also volunteer with us. We have a blog writing program which basically volunteers will write articles about different health topics, and anyone can sign up to write these articles. You will submit a draft of it. We will go over and revise, and they will ultimately be published on our website in order to help the community. You can also join fundraising and arts program volunteering. This is mainly to benefit our fundraising is to help our donate essentials to gain funds in order to donate essential items into those in need. And the arts program is where we make cards or other crafts in order to donate to people in need or hospital patients and frontline workers. Um, in the URL in our website, you can also find a join us section where you can have options to leave, start a chapter, or donate to our organization in order to support. Okay. Next slide. Yeah, thank you so much. If you have any questions, feel free to contact us or ask us.
Yeah, I just want to say one more thing. On behalf of Donate Essentials, I want to thank PinkGap again for giving us this opportunity to share a message and for the impactful work that you're sharing with, like, every other NGOs. Yeah.
Thank you so much. Yeah, that's amazing. All right. So, anyone has any questions? Feel free to leave it in the chat. Okay, if not, we'll just move on. All right. So our next presenter is Every Kid's Health. So if you're ready, please pull up your slides. Yeah.
Yeah, okay. Let me just pull them out and I'll be ready. Let me see. This might be no, I got it. I got it. Okay. Can you guys just let me know if you can see this?
Yeah, I can see.
So, hi everyone. I am Mira Patel. I am the Corporate Communications Officer for Every Kid's Health, and unfortunately our CEO is sick today, or else she would have been joining me in this presentation. But today we're going to talk about research and from research to practice, tackling neonatal infection in the NICU. And so basically what our mission is, so Every Kid's Health offers hope and health to families, empowering children to live full, healthy lives. Our programs are initiatives aiming to give every child the chance they deserve, fostering a future where all children can reach their fullest potential. Fun fact, our founder is actually a preemie herself, and this led her to founding this nonprofit last year. Okay. So, what are neonatal infections? Neonatal infections refer to the neonatal infections are infections that occur in newborns within the first 28 days of life, often affecting premature or critically ill infants. Premature babies have underdeveloped immune systems, making them more susceptible to infections. In the NICU, invasive medical devices such as ventilators and IVs can also increase infection risk. There are approximately 1.3 million cases of neonatal sepsis reported worldwide annually, and neonatal sepsis is the third major cause of neonatal deaths, leading to 203,000 deaths per year. Additionally, deaths occur more commonly in preterm and low-weight newborns, and neonatal sepsis is a critical health issue that requires effective intervention for prevention. Okay. Types of neonatal infections. You can have sepsis, which is a systematic infection that spreads throughout the entire body, leading to organ failure. Pneumonia, which is an infection of the lungs that causes breathing problems. meningitis, which is an infection of the brain and spinal cord lining, which can be life-threatening, and intraventricular hemorrhage, which is a bleeding in the brain due to infection affecting preemies. And some risk factors include immature immune systems, medical procedures, and prolonged hospital stays. So what do we know about these infections? Recent findings show that intervention with antibiotics can significantly reduce infection rates in preemies. Studies also exploring the use of probiotics to prevent infections in the NICU by promoting healthy gut bacteria. New vaccines and antimicrobial treatments are being tested to protect against infections like pneumonia and meningitis. Some challenges are limited funding for large-scale studies, particularly in the NICU setting, and variability in NICU standards and practices across different regions or countries. So, current solutions and initiatives towards infections. The best practices are hand hygiene, infection control protocols, and sterilization of medical devices. This is extremely key for preventing neonatal infections because neonates are born extremely early. Probiotics and antibiotics are being used in many NICUs to reduce sepsis and other bacterial infections, and increasing education for both healthcare providers and families on infection prevention for their children. So, starting antibiotics early. In suspected neonatal infection, especially sepsis, broad-spectrum antibiotics are typically started before lab results are available. The goal is to begin treatment within the first hour of suspicion to improve outcomes. Diagnosis of neonatal infections involves several lab tests. Blood cultures help identify bacteria or pathogens. A complete blood count, or CBC, checks for infections by measuring white blood cells. C-reactive proteins, or CRP levels, rise with infection, indicating inflammation. If meningitis is suspected, a lumbar puncture is done to ensure the cerebrospinal fluid. A chest x-ray may be ordered if pneumonia is suspected to check the lungs. And so on the side, we also have just a breakdown of suspected infections. You're supposed to start your antibiotics immediately, order lab testing, you monitor the results, you adjust your treatment, and then you observe. And if there's any more suspected infections, you go back into this loop. So this is just an interactive activity. You guys don't have to do anything or say anything, but it'd be nice if you guys could look into this. So here's a case study, neonatal sepsis in preterm infants. So baby Mia, over here, was born prematurely at 28 weeks gestation. On day 2, Mia starts showing symptoms of neonatal sepsis, including lethargy, which is excessive sleeping or difficulty walking, low body temperature or hypothermia, poor feeding, so difficulty breastfeeding or taking milk from a bottle, and rapid heart rates. Mia's birth weight is 950 grams, approximately 2 pounds, and she's in the NICU, which also NICU is Neonatal Intensive Care Unit. Key factors to consider whenever thinking about her situation is the prematurity and low birth weight, increasing the risk of neonatal infections, the various pathogens, including bacteria, that could have caused Mia's infection, because just to note, 28 weeks is extremely early for her to be born at, so she's susceptible to a bunch of different diseases, and early identification and treatment, as I just said, are crucial to improving her chances of survival. And so here are some different steps that people can take. Starting antibiotics immediately, which is empiric treatment. This option reflects a proactive approach to begin treatments based on clinical suspicion, even before confirming the infection with lab results. Discuss whether empiric treatment might be necessary to prevent complications in future. Order lab tests to identify the pathogen before starting treatment. This choice focuses on a more targeted approach, ensuring that antibiotics address the specific pathogen. Monitor vital signs and wait for signs of worsening infection. This represents a conservative approach, emphasizing observation before intervention. And finally, providing fluids and support, but waiting 24 hours to see if symptoms improve. This option suggests focusing on supportive care while evaluating the baby's progress. So here's a final debrief. So expert input, starting antibiotics early. Neonatal infections can progress rapidly, especially in preterm infants. Common antibiotics include ampicillin and gentamicin. Diagnostic testing, so blood, urine, and CSF cultures are essential for identifying pathogens, but treatments shouldn't wait for lab results in critical cases. And resource-limited settings. Starting antibiotics immediately can save lives when lab access is limited. So, also on the side, begin empiric antibiotics while waiting lab results, collect samples of blood, urine, or CSF to guide treatment adjustments, and provide supportive care, such as IV fluids, maintaining temperature, and monitor vital signs. Early action can save lives and can reduce complications in preterm infants with infections. Thank you for listening, and also if you guys want to contact with us or anything, these are our socials. But yeah, that was kind of fast, but she wasn't here, so I had to take out some things. Thank you.
Yeah, thank you so much. That is amazing. All right. Anyone has any questions for? Okay, if not, we'll move on. All right, our next presenter is Hurt Math Society. So if you're ready, please pull up your slides.
So, could you guys see the slides?
I don't think I see it.
Okay. Okay. Hi everyone. My name is Diari. I'm a junior and I'm 17 in California, and I'm a writer for Hermet Society.
Hi everyone, my name is Sanvi. I'm 15 years old and I'm an editor at Herman Society.
So, just a bit of a background about Hermet Society. It began in May of 2024, and it's a student-led initiative to unite scholars worldwide interested in medicine. So, the staff ranges from writers, graphic designers, web developers, outreach staff, and editors. And Hermet Society is a way for students to use their voices and educate people on many medical conditions or diseases they may not have known about. So, our presentation will be on the gender gap in medicine. The gender gap in STEM refers to the underrepresentation of women in science, technology, engineering, and mathematic fields. This disparity affects innovation, diversity, and progress. So let's explore its history, current state, and potential solutions.
Can you change the slide, please? Thank you. So, from the 19th and the early 20th century, women have often been excluded from higher education and STEM careers. This is due to a lot of reasons, including societal norms and their limited access to education. Some notable exceptions, though, are Ada Lovelace. She was born in London in 1815 and she is known as the mother of computers. She was the first computer programmer, and from an early age, she was faced with a society that believed that women could not succeed in math or science. While also battling with mental illness, she continued to move forward, and long before the first computer was invented, she had come up with the idea for a computer language. Marie Curie, who was a scientist born in 1867 in Poland, she faced gender discrimination throughout her life and had a severe lack of funding during her research, which made it even more difficult for her. But today, she is well known for her research on radioactivity. These two, among many others, faced significant barriers and they paved the way for women in STEM fields.
Now, during World War II, Women entered the STEM-related field jobs to fill workforce gaps, but were pushed out post-war when men returned. On to the current state of the gender gap. Women make up only 28% of the STEM workforce globally, with even lower representation in engineering and computer sciences. These challenges that they face include gender biases, lack of mentorship, wage disparities, and stereotypes.
However, progress is being made with initiatives encouraging girls to pursue STEM from an early age, but the gap still remains significant. So here are some solutions to close the gap. Starting with early education, we have to introduce STEM to young girls through hands-on activities and representation in curricula from an early stage.
Next would be mentorship programs, which would connect female students with women in STEM to inspire and guide them. Usually you can find these types of programs if you have a LinkedIn or our third would be workplace policies, which would enforce policies that create inclusive environments with equal pay, flexible schedules, and opportunities for advancement.
Challenging stereotypes, which is that we need to promote media that represents women in STEM and normalize their presence in STEM.
And finally, we would make support networks, which would foster communities that empower women to enter and succeed.
Lastly, we believe that addressing the gender gap in STEM is not just about equality, it is about unlocking the full potential of human innovation. And to quote Joe March from Little Women, women, they have minds and they have souls as well as just hearts. And they've got ambition and they've got talent as well as just beauty. By working together, we can succeed to create a more diverse, inclusive, and successful STEM future for women.
That's the end of our presentation. Here are all the socials for Hermet Society. And that is it. Thank you for having us. We're really excited to be here.
Thank you so much. I really like the transition of the slides. It's really pretty. All right. Anyone has any questions for Hermet Society? All right, before we moving on, just want to thank you for everyone like still staying here. All right, and last but not least, we'll have our last presenter, Carol. Don't mind me if I pronounce it wrong, but if you're ready, please pull up your slide.
Hello. Thank you, PinkGap, for having us today. On behalf of Cheerio, we're excited to present you tech wearables in the health field. Next slide. But this is like kind of quite unique for us, especially since we're more centered around CS as a nonprofit, but we found that tech is becoming more relevant across sectors. So let's be more informational regarding these recently emerging trends. So about Cheerio, again, we're a youth non-led profit that strives to bridge the gender gap, empower girls in STEM, specifically in computer science. And we also like want to have like bring together community. So we're gonna hope to like bring updates about tech, offering tutoring, and provide lots of resources for internships and all of that. About us, so I'm Quinn, I'm the co-founder of Cheerio, and I'm primarily interested in pursuing computer science, specifically in data science.
I'm Maggie. I'm executive at Cheerio, and I'm interested in computer engineering. So our topic is wearable technology, also known as wearables. So what is wearable technology, first of all? So technology is the application of scientific knowledge for practical purposes, and wearable is like stuff you can put on. So then wearable technology would be technology designed to be used while worn. And then we have like, can you think of any examples of these in your everyday life? And then some examples would be VR headsets, headphones, and Apple Watches. So a bit of history. One of the first wearables are these glasses created back in the 13th century. While they don't actually use like electricity, they're still technically considered technology. And then Salvino de Marti is accredited to this invention, but they can't really trace the de Marti lineage back to find this actual person. And then the first wearable computer was created by Edward Thorpe, who was helped by Claude Shannons. And then this was used to predict roulette. It was like a timing device, and they'd put it in their shoe. So then, wearables in medicine. Why is this related to medicine? There are a lot of wearables in medicine, like hearing aids, smartwatches, blood monitors, sensors, and other monitors. And then wearables are an intersection of both medicine and computer science, which are one of the more developing fields in current day. Yeah, and then there are plenty of wearables and technology being developed for medicinal purposes. So here are some examples. Sensors in cancer. Here are two examples. The one on the right over here is an invasive one where they put this catheter inside your blood and then they use it to monitor your blood. So they're looking for a circulating tumor cell, CTC, which is a biomarker for cancer. And a biomarker is a molecule found in the body that is a sign of disease or abnormalities. See, circulating tumor cells are like biomarkers for early stages of metastatic cancer, which is cancer that just moves around. And then, so these CTCs are really scarce. There's like 1 to 10 in every milliliter of blood, but there's like 4 to 6 million cells in a milliliter of blood, so they're really hard to find. So, like blood tests, when you get your blood drawn, they get like 1 or 2 vials, and they're like way too little to detect CTCs. But through like constant monitoring using this device, they have a higher chance of finding CTCs. And then this wristband on the left is a sweat sensor. So this researcher, Wei Gao, I think, he's working with the American Cancer Society to help better identify ways to treat people with leukemia. So this device is used to help identify biomarkers, and currently he's like they're like on like patients with leukemia, and then it like monitors the sweat and like biomarkers in the sweat to help identify the biomarkers. Like all the data goes to an AI, and then the AI is used to like sort through the data and see like common biomarkers. So this is wearable neurotech. So like usually the first thing I think of when I hear neurotech is like transplants or like implants. So like putting a chip in your brain, for instance. But here this is a wearable piece of neurotech that uses electrostimulation to help treat depression and other psychological disorders. The brain like communicates through electrochemical signals. So then if you take like prescription drugs, they're like the chemical side. This is more of like the electrical side, and it like is used to help treat these psychological disorders. Some negatives of it though is that they aren't entirely sure of the symptoms because it's a new device. So there could be like some bad long-term side effects that they haven't discovered yet.
Now that we've seen the applications of tech in the med field, you might be interested of how you can combine tech and med into a career itself. There's a variety of careers out there that you can work towards. Some universities may offer specialized programs for these kind of subjects. So one of the most common ones are biomedical engineering, which combines engineering and medical knowledge to develop devices, systems, and technologies that improve healthcare, such as making prosthetics, imaging devices, or even surgical tools. Another one is bioinformatics, which focuses on using computational tools and software to analyze and interpret biological data and information, such as genetic sequences, basically in like genomics and medicine. We also have epidemiology, where you can study patterns in diseases and populations, so you can help identify risk factors and help prevention and control, basically. So that's kind of statistics related. And then there's also such thing as computational biology, where you use computer science, stats, math, all of that in order to understand biological systems and all of that complex stuff. We also have biostatistics, which is also kind of similar. Again, you apply statistical techniques to design studies, analyzing data, and interpreting results in public health, clinical trials, and even medical research, etc. There's also health informatics, where you can integrate healthcare, IT, and data science together to manage and analyze also medical data, improve patient care, and even optimize healthcare systems. Systems Being a systems biologist means you have to like study complex biological systems again and interactions using biology, computational modeling, and even data analysis. And finally, you can just be a data analyst as a whole. In general, in data science, you gather, clean, study data, and often you can apply that to many fields, including in the health field. In terms of opportunities, if you want to like start getting into that stuff, you can like, since you might like just be like in high school, right? Just get started. You can basically work on your extracurriculars, putting more effort into volunteering, your work experience, for example. Maybe look if you're like into med entirely, then just make sure to like volunteer at your local hospital or looking out for internships in your area to get exposure to the med field in general. And you might have heard of the term passion project, which is another thing you can work on, whether that be creating an app for like a medical disparity or something, whatever highlights the topics that you're passionate about. Note that you really need to be like committed to it, and it's a good way to show that you have a soft spike, meaning you have like a main interest you want to get into, and then like a smaller interest that also makes you stand out, right? And then at your school, try to get involved in many clubs as you can to match your interests and be consistent so you can rise up in leadership. If you don't have a club you don't see, then you can see if you want to like start one. Summer programs are also great ways to gain research and like gain learning experience. There are lots of them out there. I've only listed a few, like Boston U Rise, I think it's called Summer Science Program or whatever, that's offered at like some schools, all of that. Some of the deadlines are actually pretty soon. So if you're thinking about it, then just start like actually getting into applying. On the next slide, this is kind of self-promo, but we also have general positions open at Shariel if you're kind of interested in computer science. But even if you don't know much about it, some of the roles that we have like don't even need that much experience, such as like graphic designing, right? And you can see like all of our pretty graphics on my slides, it's made by our graphic design director. So shout out to her. So if you want to look for more info about that, you can just scan this QR code on the screen. But you can also just check out our Instagram and we have all that information there. Also on our next slide, we also have a Python workshop, which I believe is going to be next week actually. But I'm just putting this out there because Python is a fundamental coding language, especially for data science and analysis and more. It's actually as I said, it's next week. So be sure to scan out this QR code to just sign up now. So anyway, thank you so much for listening. I know that was a lot of information, but if you have any questions, feel free to let us know. Of course, be sure to follow us on Instagram to stay updated on what we have next. And our email is always open to inquiries.
Hi, that is amazing. Thank you so much. All right, so this pretty much brings us to the end. Anyone has any questions for Cheryl? Okay, so if not, I'll just do the wrap up right now. So basically, PinkGap, we're still hiring as well. So we're looking for outreach, social media, and fundraising member, as well as tutors for our tutoring program. So if you're interested for that, here's a link. You can just scan it. Yeah, so that's basically it. Thank you so much for everyone participate for this conference tonight. And yeah, thank you guys. Bye.
Thank you.
Thank you.